Mental health services offered at Stanford Sierra Youth and Families has evolved quite a lot over the years. When I first started at Stanford, I was a clinician and we only had programming in Sacramento County. And we've since spread to several other counties, which has been really exciting to see. Every contract with every county is just a little bit different. The nice thing is that there's a lot of flexibility built in so that we can really meet the needs of the family. So it's definitely not a one-size-fits-all service. We can provide anywhere from your typical or traditional, I should say, outpatient services, which is maybe less frequent, less intense, all the way up to more intensive services where we might have more team members providing different types of services, anywhere from therapy to parent sessions, psychiatry services, therapy, and skill building sessions. Mental health services are so important for young people now more than ever. There is so much going on in the world right now. Families are under a lot of stress. Parents are worried about losing their jobs, their homes, not having health care. There's just so much happening. And so with families being under a lot of stress, kids are under a lot of stress as well. They're feeling what's going on. Their parents, they're feeling it themselves. There's been so much that they've had to deal with outside of what they're already dealing with in their lives. And so doing distance learning, for example, is very hard for kids. Not seeing their friends has been really difficult for kids. So I think right now mental health services is so important. Kids need an outlet. For adults, one could say at least we're able to, maybe make decisions and changes. Whereas kids, adults are often making decisions for them. So it's really important for kiddos to have a voice and a place to be able to talk and share and be heard. So we really work hard to support youth and families with maintaining their placement. And what I mean by that is making sure that kids aren't being placed in out-of-home care, going to higher levels of care, such as a hospital setting or an inpatient setting, and ensuring that they can stay in their homes with their families in their communities where they live. I'm very passionate about the work that I do, especially because I work at Stanford Sierra Youth and Families. We are not just an agency that has a mission written down on a piece of paper. We truly live it and work it and breathe it every single day. And that speaks to me. I love working with people that share the passion that I do. It's so rewarding. I always knew that I wanted to work with kids and families, and I just wasn't sure what capacity. When I started in this work, it was amazing to see the changes and the growth that we would see in kids and families. Just to share a couple of examples, I've worked with youth that have come to us having had multiple placements, living in several different cities and several different types of homes, where it be foster home, group home, in a matter of 1 year. And then they come to us and we support them with finding a stable place, a permanent family. And so that's part of why I'm so passionate about this work. Like I said, I love working with kids and being able to give that special time to a child in therapy sessions where they can feel heard and they can feel like their voice matters. That is very important to me.